Greetings and welcome to our monthly webinar hosted by the Institute of Public Health. I am Abu Bakr Suleiman, an instructor of biostatistics at IPH. This webinar is a part of the global initiative known as This is Public Health, which aims to shed light on various critical public health issues. We are honored to have affiliation with ASFER, the Association of Schools of Public Health in the European region, and the EBHA, Emeritus Public Health Association. Let's go over a few housekeeping items. Throughout the webinar, you are encouraged to ask questions. To do so, simply click on the Q&A option located at the bottom center of your screen. Feel free to submit your questions during the presentation, and we will address them at the end. Please note that this webinar is being recorded, and the recording will be available on our YouTube channel, Institute of Public Health-CMHS, where you can also find recording of our previous webinars. It brings me great pleasure to announce that this webinar has received accreditation from UAE University as WEN CME Category 1. Therefore, at the conclusion of the webinar, we will provide a link in the chat for you to evaluate the webinar. Your feedback is priceless, and by completing the evaluation, you will receive your CME certificate participation. Now, it is great pleasure that I introduce today's teamed speaker, Prof.Assaf Alassaf. Dr. Alassaf is an international consultant in healthcare quality, patient safety, and hospital management for the last 35 plus years. Dr. Alassaf is a physician with a master's degree and a diploma in cardiothoracic medicine from the University of London. He also holds a Master of Public Health Administration degree from the University of Oklahoma, member of the American College of Cardiology, fellow of the Royal Society of Health, to name a few. He also certified as a quality analyst and holds certification in infection control, risk management, and patient safety. Dr. Alassaf has published 17 books, 8 book chapters, and over 170 scientific and professional publications in international and international journals. He also presented lectures, seminars, or workshops to over 350 groups and organizations, both nationally and internationally. He is a reviewer and editorial board member of several American and international journals. Dr. Alassaf is a recipient of more than 100 awards and recognition, including Who's Who in America and the world. At the American Institute for Healthcare Quality, and since March 2013, he served as the executive director and has delivered numerous courses to healthcare professionals worldwide. He provides advice on healthcare system, strengthens and accreditation in the US and other countries worldwide. His consultation extends to such organizations as US Air Force, US Agency for International Development, World Bank, UNDP, UNICEF, and WHO. He has also provided advice on system strengthening to a number of organizations and served as advisor to health ministries in different countries. As a researcher and public speaker, he served as a distinguished regent and presidential professor, dean for international health, and adjunct professor of geriatric medicine, nursing, and liberal studies at the University of Oklahoma for more than 28 years. He also had several adjunct and visiting professor appointments at several universities inside and outside USA. The title of his presentation is AI in Healthcare Benefits and Drawbacks. Professor Assaf, the virtual floor is yours.
Thank you very much. Thank you for this presentation, Mr. Abu Bakr. It's really given me pleasure to be with you guys and ladies. We will spend about the next 45 minutes to 50 minutes of the presentation, and then we'll have some time for questions and answers. This is my first webinar with this university, but I've done webinars throughout different places. So today, as Mr. Abu Bakr mentioned, that we're going to discuss the issue of artificial intelligence as it relates to healthcare. We're going to look at specifically to the benefits of AI, and there are plenty of benefits. But also, we're going to talk about the drawbacks, the risks, the problems associated with AI if it is in the wrong hands, more or less. So let's start with the presentation. I'm going to share my screen. Hopefully everything will go smooth. Okay, so there is there's the presentation, and let's go over. Okay, so really, we're going to talk about, as I said, AI, and we're going to talk about how AI has impacted or will be impacting healthcare, in particular the medical care in the area of diagnosis, management of diseases, treatment, and so on. So we're going to discuss all that. Okay. So of course, always you have to describe what is AI. What are we talking about? So here it is, a definition of AI, as you can see. Use of advanced and machine learning techniques. You analyze complex medical data. Use a collection of applications for diagnostic imaging and other analytics. The most important part of the AI is the integration of all these systems, activities, knowledge together to produce what is expected for AI to do, which is diagnostic accuracy, optimized treatment strategies, streamline administrative processes, and ultimately, of course, improve quality and efficiency of healthcare. So here are two slides I'm going to share. This is the first slide. This is the second slide. It shows you what are the different terminologies that are used in AI, and it's a long list, as you can see, but I'm just going to identify some of those that keep coming again and again. For example, chatbot. What is a chatbot? Chatbot, as you can see, is a software application that mimics human conversation. ChatGPT, a chatbot powered by large language models that can generate human-like text developed by OpenAI, and it's as an example of a generative AI. Algorithms, step-by-step set of instructions that a computer follows to solve a problem or perform a task. Also talk about generative AI. AI models that analyze training data and then generate new data with similar characteristics. Okay, so these are others, like machine learning, where computer analyze data to perform tasks without being specifically programmed to do so, using patterns discovered in those data sets. These are some of the test or the terminology that I use for AI. Okay, so let's talk. Let's go deeper into the AI, and especially in healthcare. So AI is, as you can see, is entering healthcare with all kinds of applications, all kinds of ways to affect healthcare. I kind of talk about healthcare. When I talk about healthcare, when I talk about healthcare, I usually talk about the medical care. And when I just say healthcare, it's broad. It includes medical care. It includes public health. It includes administrative care as well. So AI has really got involved in all of those. And there are a lot of lots of applications. I'll show you some of those applications in a little bit. But there are, of course, some challenges, and there are some risks using AI. And there are a lot of people who are more worried about AI more than anything else for some reasons, and we're going to discuss that. Okay, so what are some of the benefits? Well, here's a list of some benefits, and there are several lists that I prepared. One of them is improved diagnostics or diagnoses. It can provide accuracy, it can provide efficiency, it can provide effective diagnoses, whether it is the imaging, whether it is pathology slides, whether it is putting data together to come up with the right differential diagnoses for a patient. All of that, it can improve diagnosis to max, and it's incredible how can produce more efficient results than human beings. For example, there was a study done. I don't remember which university did it, but they collected a number of of X-rays, and they gave the same X-rays to a group of highly specialized radiologists, and they gave the same X-rays to AI, to artificial intelligence, and AI was more accurate in making diagnosis, almost like 90% to 80 to 80 or 75%. So it's a major difference in that. So there is a improved diagnostic purposes. Personalized treatment. It can take each person's characteristic, each patient characteristics, and look at the history of the disease and the prognosis of the disease and come up with a personalized treatment that's more effective for that person rather than for the set of patients in the same characteristic. So that's a personalized treatment, which is more accurate and hopefully more precise, that affects the disease process. Enhanced efficiency. You can generate a lot of outcomes, a lot of tasks in a very short period of time. You don't need the number of people, that you don't need a number of tools. It's all done in one setting and one activity. So efficiency is major. Remote monitoring, and there's a lot of activities going on in remote monitoring, and that started with telemedicine, and now to wearable devices, and then all to pods, medical pods, where people can check in a pod, and that pod has all the sensory requirements that will calculate its or measure the vital signs. It asks questions and produce some results, and that is very similar to a clinic. So that's going on in that area. So remote monitoring is major. And then of course the wearable devices, where people can wear devices and their healthcare can be monitored from a distance, from their provider or from other organizations. So it's and it's getting even better and better. I mean, who knew a few years back that instead of pricking your finger and getting blood so that you can measure your glucose or whatever, now you don't even have to do that by scanning through waves, through whatever, and now you can measure all kinds of indices. So these are improving and even moving in that direction. Drug discoveries and development. What's really interesting, what I liked about that, is that AI can look at what drugs have had as positives and what drugs have had in negatives, and then look at a huge number of studies, huge number of drugs, huge number of applications, and come up with the precise combination of drugs or combination of chemicals that could produce a new drug that may be even more effective in the treatment of certain diseases. So there is a major area in that, and I think that the future is even bigger and much more optimistic. What also I liked about the drug discovery and development, when we do the testing of the drugs, we usually do it with the clinical trials. Well, AI now can do clinical trials virtually. Don't even have to recruit people and make sure that they are the right characteristic and whatever. AI can generate virtual patients and virtual control groups and virtual clinical groups and test on virtually on these individuals. So it is amazing what the application of in this drug discovery and development will happen. Decision support. This is more about helping providers make the right decisions. So decision support, it can be, oh gosh, the sky's the limit. It can provide recommendations. It can nudge the provider in looking in certain areas that the provider may not know. We always had the idea of second opinion or third opinion. Well, AI can do that on the spot. The provider can ask, what are the different opinions in this case, and you can get not only 2 opinions, maybe 3 or 4 or 10 if you want, and at the same time. You don't have to schedule a meeting or a visit and whatever. So decision support tools is immense, and you can get all kinds of areas involved in that. Operational efficiency. Using the algorithms, one can make it very precise, very accurate, and then therefore you may not need to have too much resources allocated to certain activity. AI can combine all kinds of resources together to come up with an answer or provide you with an activity. So it can increase efficiency, and it can increase, of course, effectiveness as well. What about the benefits in hospitals? Accuracy, for sure. That's an important aspect of all of that, whether it is in the diagnosis, whether it is the treatment, whether it's in the prescriptions. Accuracy is one of the main characteristics of AI, using AI in healthcare. What about sharing experiences and expertise? Those people who are in research, whenever you're looking at a specific conclusion of a certain activity or a certain intervention, well, you look at number of studies and then combine all these studies and come up with a final conclusion. This is a meta-analysis. Well, AI can do meta-analysis on the spot. You don't even have to dig into the literature and read every article. One time I did a meta-analysis. I had to read more than 150 articles to come up with a conclusion as little as 1 paragraph. So imagine, it took me hours and maybe days. Well, AI can do that probably in less than 2 minutes. So that's a major improvement. Automation. It's of course, you can automate processes. So instead of repetitive processes, AI can do these automated processes really fast and very efficient. Effective care, effective utilization. We talked about that. Choices, outcomes, give you a lot of choices, even to not only to the doctor, but also to the patients, to the technicians. So it can give you different modalities and ask you which one is best. So these are some of the things. Assist facilities in rural areas, and that's about remote monitoring and remote healthcare. And now we're moving not only in the remote monitoring, but also in provision of care, and maybe in the very near future, maybe remote interventions. So that's another thing. What are other secondary benefits, such as lower referrals, reduced cost, saving time, all of that? Enhance the data availability and accuracy and aggregations and analysis and integration, all of that related to data. You can do it. I work in analyzing data quite a bit. So analyzing data used to be, you spend days, if not months, analyze a database and come up with some conclusion. Well, AI, you can introduce the data to AI and ask, what can I do with this? And AI can give you all kinds of ideas. It's amazing the type of assistance that you can get, whether it is you are a researcher or a provider or a technician using AI. And then ultimately, AI can contribute to equitable system for global healthcare, and that is a question mark. And I'll talk about that, especially when it comes to bias and it comes to the application of AI to different ethnic groups and different minorities. Okay, so what are some of the applications? Well, I just identified 3 main applications that are major applications. These are a collection of applications, let's put it that way. One of them is the IBM Watson, and this one is the one that has been the most successful application of Watson is for oncology, where it one of the problems with oncology is that we are using toxic substances to kill cancerous cells. So if you are if you're not precise in the dose, if you are not hypersensitive from a patient standpoint, if you are using the wrong medication, wrong combinations, wrong integration, you may harm the patient more than benefit the patient with killing the disease. So with AI, that can be more precise, and it can be personalized based on the patient's characteristics and even the patient genomics and the patient progress, the disease progress. So based on that, you can tailor make drugs to affect the patient with cancer. So that's one of the application of Watson, and there are of course other applications. What about the DeepMind, Google's DeepMind, and also Gemini? That's another major AI application, and that's they used it in acute kidney disease, and they found a major development and major improvement using AI in this. Others, the FDA wearable devices, there are all kinds of tools, therapeutic, diagnostic tools that FDA is not even having enough time to review and come up with the decision on whether these are safe or not safe for human beings. And this is an example of the Watson. So what about specific applications? Well, here is one specific list of specific application in one field of medical care, diagnostic radiology. And you can see there's a lot of areas where diagnostic radiology. It is almost, people are talking that with the use of AI, you may not need a radiologist 5 years from now, or even less sometimes, especially general diagnostic radiologists. So radiologists may have to change their interventions, not into diagnostics, but more into interventions rather than diagnostic or interventionals. So here are some of the applications for diagnostic radiology: image segmentations, computer-aided detection. It can be precise in detecting any lesions, any problems on the X-ray or the MRI or CT. It can reconstruct the image to produce a more accurate and more clear image, much more clearer image to a regular image, and that will enhance the interpretation of the image. So all of that. What about automated report generation? I've spoken to several radiologists that tell me that they tell me that, yeah, looking at images and coming up with the conclusions is one thing, but then writing the report which takes a long time, is another thing. Well, here it is. AI can generate reports for you, and can generate it accurately and efficiently in a blink of an eye. What about quantitative image analysis? It can look at the analysis and it can measure the difference between one image versus another. There was a case a few years back. My wife is an attorney who was suing an organization because the patient came to the doctor, and the doctor delayed the referral to a specialist. And because of that, they found that once the patient saw the specialist found that there was a colon cancer, or a mass in the colon, and that mass has gotten bigger and metastasized to different places, and the patient died in 6 months. So the question was, that delay, whether the 6-month delay, let's put it that way, was it really the reason the patient died, or was the progress of the disease the reason why the patient died? So at that time, AI was not used in those cases. So it was the burden of the lawyer and the doctor was to precisely measure every millimeter of increase in size, and what does that millimeter has an effect on the adjacent organs. And all of that has to be done manually over a 6 months period. So imagine the amount of calculations you have to do. Well, AI can do that in a blink of an eye. Imagine. It's incredible how the changes, quantitative image analysis, image registration and infusion. It can look at several images and provide you with an integrative approach. It can look at several images together and come up with an integrated approach. That's a major improvement to a regular imaging interpretation. And then predictive analysis. It can look at previous studies, previous images, and come up with what will be the forecast for this kind of disease or for this kind of patient. So that's predictive analysis. What about clinical pathology? Similar. There are all kinds of applications in clinical pathology. Again, I would say pathology will also be affected quite a bit. So pathologists may have to change their focus on from reading slides to something else, because reading slides now, AI can read the slides and probably can read the slides even better. But but more interventional, that may be the way to move. And here are some of the application, whether it's digitize all the slides or digitize all the information, the histopathology, interpret the analysis of the image, the triage and screening. You can do a screening over a number of patients very fast and come up with a method or a decision on how to move one patient from one area to another, or triage that patient where those patients require immediate attention versus those require, don't require immediate attention, can be identified through AI. Digital cytology can look at the cells, and digitize all that process. And then by digitizing it, you can apply the measurements and you can apply the algorithms and so on and so forth. Make it easier for you to diagnose and also produce a good idea of what is the prognosis for that, genomics and so on. So these are some of the applications for clinical pathology. So what about the other area? Another area is healthcare design. And that's also a very fascinating area for AI to be involved. AI will move the intervention from the inpatient to the outpatient, and will move the intervention from a complex settings in an inpatient setting in a major hospital to more into pods and outpatients and smaller facilities. So you really don't need large facilities anymore with AI. There will be telehealth implications. There are, as I mentioned, there are the medical pods, and those are separate. You can put them anywhere, everywhere. You can put them in malls. You can put them in shopping centers. You can put them in even inside hospitals or clinics. And these are self-directed. You don't need clinicians to be there, and it's all done through use of gadgets to measure all kinds of indices, and then either sent to a provider to review it, or can be done through AI. Design shift. This again, you design the organization instead of the regular. Like I'm helping one of the hospitals design a new hospital. So I'm looking at patient flow, how the patient flows from an outpatient to the inpatient. What about an inpatient going from one area to another? What about operational patient, surgical patient? What about emergency patient? So patient flow is very important in the designing of hospitals. Well, I can do that. You don't have to get involved into all of that. And then you may not need to dive into the patient flow as much, because a lot of the activities could be done either remotely or outside the hospital. So by the time the patient is coming to the hospital, everything is almost done, only with certain intervention and very precise and specific interventions. What about virtual reality? You can provide virtual reality. So instead of doing surgery on an actual patient, you can do surgery on a virtual patient and see what the outcome is, and look at mistakes that could happen on a patient. What about the virtual environment, looking at all the instruments that are used virtually and learn how to use those instruments instead of learning it physically on a patient. So that's another big area. What about the shift away from the general care capabilities towards specialty services? General care can be done outside, can be done by remote areas. So all of that could be another application of AI. What about the medical devices? There are all kinds of medical devices. In fact, somebody was mentioning that the medical devices will shrink in size and improve in capabilities to an astronomical levels. It will not be that far away where we will have a CT scanner in the palm of our hand, where a device in the palm of our hand that can do a CT activity just like a regular CT scan, or even MRI to that end. So there are the computer-aided diagnoses, medical devices, interpretation of EKGs, predictive analysis of disease risks. So again, looking at the prognosis of the disease and the progress of the disease, and see what are the risks and what are the predictive models for that disease. Personalized treatment using genomics to identify specialized treatment and more specific to that patient with the right characteristic, with the right genetics, and come up with the right diagnosis and the right intervention. So that's a major improvement as well. What about drug discovery? We talked about drug discovery and the use of clinical trials and testing of drugs. You don't have to you do that virtually. All of that can be done virtually, and that without affecting people. I remember whenever we're doing some of the clinical trials, we have to make sure that we get a IRB approval. We have to make sure that we don't harm the patient. We have to select patient. We have to recruit patient. All of that. Well, AI can do it. Can identify all that virtually, and can provide you with virtual clinical patient and virtual control patients. So that's another improvement in that area. What about monitoring? We talked about that, monitoring, remote monitoring and remote wearable devices. What about the analysis of images, and whether it is histopathology images or general images, X-ray or computerized tomography or MRI, whatever images. What about using language, natural language processing? And in that, the NLP is just major activities that are happening in that field, whether it's taking notes, whether it is talking to the patient, whether taking histories, whether discussing different models. All of that can be done in an instant. In fact, somebody was mentioning that in the very near future, you may not need even interpretation. Different languages even. The AI now can provide you with instant interpretation, and they are improving certain applications that you can wear certain headphones and you walk in a room with different languages, and AI can capture all these languages and translate it to the language that you are listening to. So imagine it's what can you do with that kind of technology, and how can that help you in reading medical literature, to discussing different methods with different researchers, different providers in different countries and different continents. All of that it can be done. What about the virtual health assistants? That's another thing. It's administrative. From robots to virtual assistants now can have. You don't need to have people taking notes. AI can do that. In fact, there is now you can even now, as we speak, you can buy some gadgets, and as you enter a meeting, you put the gadget on, and you start your meeting and finish your meeting, and then that gadget will capture all of this information, produce a transcript of whatever happened during the meeting, and then produce a summary of that meeting and identify the main areas that the meeting has come up with. So you don't need a stenographer, you don't need a secretary for that purpose. So, and these are just an idea of what could happen. Okay, what about other areas? Here is AI in mental health. AI can work as a psychiatrist, and it can collect information using AI instead of a psychiatrist looking at the case. Can collect all of that and even come up with some modalities where the psychiatrist can come up and say, okay, I will use this this treatment versus another treatment. Also, what about it can do smart audits? One of the Edward Deming, in those years, he said, cease dependence on mass inspection. And what is that? Mass inspection. We do a lot of inspection on facilities, lots of inspection on medical records, lots of inspection on tests and so on. Well, and that's time consuming, lots of people, lots of resources to be used. Well, with AI, you don't have to do all these inspections or audits, or you can do some of these audits, but specific, smart audits. You can focus on certain areas that needs to be audited rather than the whole gamut of different activities. So these are some of the issues. You can use different databases and pull all these databases together and come up with a summarized database where it can be interpreted easier. CMS, Center for Medicare and Medicaid Services. One of the activities that CMS loses each year billions of dollars because of fraud, because of abuse by the healthcare workers, intentionally or unintentionally, it doesn't matter, but it is fraud. And they have literally a department with hundreds of people, specialized people, just to review bills and review charges to make sure that it is the right thing. Imagine what AI can do that. What can do? AI can go through all these and identify patterns, identify areas that questionable, and instead of having people going through papers and paperwork and going through different information, AI can identify that and hone into the audits of those areas or those clinicians that have certain patterns that are questionable. So these are some of the issues. Others, the public health, can diagnostic imaging, can apply public health in the natural languages. What about the medical research? We talked about medical research and what can you do with that? What about medical training? Virtual training, incredible what you can do with virtual training. What about medical professional support? And we talked about the support that you can have, whether it is supporting the nurses or support. I see one area that one of the standards in Joint Commission requires that it's called the early the early alarms, early patient alarms. So there are certain vital signs that you have to check, and to check every patient, and you have to check it on a regular basis for every patient, because by changes in those vital signs, it can give you an alarm that the patient is deteriorating. Well, that is done manually right now by nurses, and nurses have to go through the clock, and they have to have certain indicators, and they do that. So with accreditation, a lot of hospitals have a problem with that. Well, guess what? AI can do all of that and do the Muse, the Pews, the modified early alarms, done on the spot without need of anybody to intervene. It will give you the results. It will monitor on continuous, not only on every 15 minutes or every 30 minutes. It can monitor continuously, and it can give you an estimate of what could happen and what is the prediction for that. So these are some of the issues that could happen. Others, patient engagement. You can have the patient interact with and one example is Siri in iPhones, but imagine Siri in a more magnified manner in healthcare, where patients can interact and ask questions about healthcare, about medicines, and so on. And AI can provide that. Remote medicine, and so on and so forth. So these are some of what about the drawbacks? And that's what's really important is about the drawbacks. And I'm going to really go through specific ones. First, transparency. You don't know how AI has come up with these decisions and ideas. So it depends. The algorithm that they use, you don't know. As me, I'm not a technician. I'm a clinician. I don't know how they came up with the decision. So is it correct? Is it not? We don't know. These are what they call black boxes. What about the privacy, security concerns? AI doesn't, sometimes I have some information about a patient. I kind of keep it, give it in small bits and information, not to increase the blood pressure right away. AI doesn't have that, doesn't have the emotion. So it just blip all kind of information. It can give you all kinds of decision. And if somebody send a letter saying, give me the information on this, AI can spit it out without concern of privacy and whatever. So who's going to be responsible for that? What about the hacking? That's a security issue. What about bias and discrimination? AI is made by human. So depending on what's the bias the human put in, the bias you get out. So it is basically whatever data you put in, you get certain types of data out. So if the data you put in is biased, is kind of questionable, you'll get a data that is also not acceptable and not and biased and so on and so forth. And then there's discrimination, all kind. There's legal and ethical implications. What about if AI causes a problem, causes a medical error, who's responsible? Is it the doctor? Is it the hospital? Is it the machine? Is it the AI? Who is responsible? And that's legal implication and malpractice issues. Even the malpractice laws have to be changed related to that. What about workforce displacement? They say that we will, in the next 5 years, and by 2030, they predict we will lose 300 million positions. 300 million positions. But we will generate new positions, about 97 million new positions, new areas. So people have to either change their career to different areas, or forget about their career because it's going to go away and move to the new areas. So these are some of the workforce displacement. What about over-reliance on technology? People become too lazy, laissez-faire. Well, if I don't have, okay, let me ask AI. AI will provide me this. AI can do that. AI can do that. So that becomes over-reliance. And then the cost and accessibility. Not everybody can afford AI. Not everybody can afford these wearable devices, and so who can afford and who cannot afford it, and whether the early cost, how much it's gonna be. What about acceptable by caregivers? That's a major issue. A lot of caregivers are so afraid of AI they don't want to even use it. They don't want they are even fighting not to have it included, even though they know it is very useful. They're scared, they're insecure, and they are afraid that it will take some of their jobs. Other problems. We talked about a lot of those areas, but what about the AI may identify certain diseases that only inherit in certain type of population, not in other population. And that could cause bias and could cause discrimination in some areas. What about staffing of healthcare professionals? Again, the removal of certain positions, and these are positions, especially the first position that will be gone are the small, low-level positions. And the low-level positions are usually occupied by minorities. So those people will be affected the most. And that could be considered discrimination. That could be considered bias, whatever you want to call it. That's going to affect those people. And then, of course, there is the negatives that could happen from it. What about the ethical issues, the autonomy, the dignity, the truthfulness? There is no human interaction, so machine doesn't have the affection as a human being, so they can come up with answers that a human being could not may not accept, and so on. So provider relations as well. So other risk there, we talked about almost all of that. I want also the intellectual property. There was a case the other day where a judge fined a lawyer, I don't know how many thousands of dollars. The reason, because the judge found out that the lawyer has developed a brief for the case, using AI. So now the question is, who owns that property? Who owns this intellectual property, and who to sue, and how can you protect your intellectual property that way? So all of these that are issues about AI. So what are others? I mean, we kind of discussed all of that. I'm just rehashing the information. We talked about errors, we talked about biases, we talked about transparency, and then of course we talked about the academic and research implications as well. So the issue is transparency, equity, informed consent. All of these are ethical issues, and one has to spend more time on those, and how can we override these kind of things. WHO have bring your attention to this. WHO has come up with a wonderful publication, and it's about ethics in AI. So I would encourage you to look into that. It's about a 100-page article that talks about all of that. So these are some of the issues that they have come up with, and we talked about all of these responsibilities. So the ultimate goal for the forecast is to design the healthcare system where AI can be used in certain areas, but not in every area, and make sure that you understand the drawbacks and some of the risks associated with AI. So we propose a public-private partnership, create a nationwide network of healthcare AI assurance labs, and would offer objective education and ongoing assessment models in healthcare. It is an exciting, confusing, frustrating, optimistic to be in healthcare and continuing maturity of artificial intelligence. It produces mixed emotion of the ongoing debate, and there may not be clear answers, but there were. So this is a really interesting quote, and I really believe in what's happening. So I stop here. We have about 10 minutes for questions and answers, and hopefully I can answer some of your questions. Thank you very much.
Thank you very much, Prof.Assaf, for the valuable and informative, comprehensive presentation. So we will go for that. But before that, let me quote the statement from Dr. Andrew, the Stanford adjunct professor. He said that AI is a new electricity. And it isn't, because it's affecting, like, this just healthcare. Just think about education, engineering, etc. Is like affecting all the aspects in our life. So we'll start with the first question from the audience. Is about, doesn't AI make human less skillful and have less experience?
Yes. Well, yes and no. The good thing about it is that it will make healthcare and the everything related to healthcare much more accurate and much more effective, and of course much more efficient. Yes, it will affect certain professions more than others, not all. Certain professions more than others. It will start affecting the lower hierarchies of professions, as I mentioned. The secretaries, the assistants, the clerks, those will be affected the first, and then goes up the ladder as we generate more and we improve improve the application and improve AI itself. Even among doctors, I would say general practitioners, find a new job, find a new area. I mean, really true. Radiologist, general radiology, I'm sorry, you made your career over the years. Now it's time to change. Either you go to interventional radiologists or change your career. 10 years from now, I don't think there is a radiologist. What about pathology? Same thing. So there are certain professions that could be affected other than that. So there are some positives, there are some negatives, and one has to adapt to work on it, because there is no other way. I mean, there's no returning back. We cannot say, oh, we stop it. We cannot do it. There's no way. I mean, it's going, and it is a trend, because there are lots of good things that come out of it, but we have to harness it, and we have to control it. And that's where people are talking about international bodies that can harness and can control and monitor the effect of AI. Thanks.
Exactly. I couldn't be more like agree with this statement. And actually, we have another point of view that I think we were discussing AI in medical schools and how to incorporate it into curriculum and so on. So AI is there, the model prediction is there. We need to train our medical students to interpret the results.
Yes.
Or
exactly.
Or
That's
like
it.
to weigh the evidence.
Yes.
Or to see if the prediction is reasonable or not, and so on.
Yes.
So
that's the other issue is AI can help you make it as a decision support tool rather than the tool to make a decision for you. It's decision support. You are the expert. AI is the assistant to you. Don't make AI the expert and you sit behind and say, okay, AI said that. Well, no, you need to weigh the positives and negatives yourself before you come up with a final decision.
Exactly. So one question is regarding how does AI improve patient outcomes in healthcare?
Yes, good. Well, patient outcomes, there are a lot of issues related to patient outcomes, but patient outcomes is all dependent on how you treated that patient, how you manage that patient. So how you manage that patient is what kind of information you gathered from the patient, what kind of interventions you have done for the patient, what kind of options you had that patient. AI can do all of that in a very efficient and effective manner. It can help you in refine the right diagnosis. It can help you identify the right treatment. It can identify the right interventions. It can even identify what is the prognosis of your disease, and how far you can stretch it, and how far you can improve it, and also to identify areas or other positive interventions that happened in other areas that can apply to your case. So it's a major improvement in patient outcome, and hopefully, and as you would know, that patient outcome is not only clinical outcome, but also the emotional, also the support, and AI can provide all of that with different applications and different modalities.
Exactly. One case is about the Framingham risk score for predicting 10-year cardiovascular disease. And now they are discussing like including the CT output into the model. And of course, they don't need a radiology or expert. The deep learning algorithm or whatever will do the calculation, will extract the important feature, and then add it to the Framingham risk score, and they get the prediction. Actually, they showed that the new prediction is more accurate than the original.
That's what's really fascinating. That's exactly what's in fact, what fascinated me the most is when AI now, I remember when we were doing some of our interventions studies, we had to go and recruit patients, and I have to identify the right patient, and then we have to recruit the control groups, and have to make sure that the control groups and the cases are somewhat characteristically similar, and so on and so forth. Well, guess what? Now you can do all that virtually. You don't even have to have the patient. It's amazing what you can do and what kind of applications can happen. But again, as you mentioned, which is really, we should emphasize that we should not make AI the leader. We should make the AI the follower. We are the leaders, and AI should follow. AI can be useful to us to make our decisions, but not AI make the decisions for us. And that's very important.
Exactly. One more question is regarding how can healthcare professionals work effectively with AI?
Good.
Systems and models?
Yes. I would say for a healthcare professional, any healthcare professional, educate yourself about AI and what are the different areas, what are the different applications, and so on, especially in your area or your specialty and your career. So learn about it. Learn what AI can help me in my career, in my job, in my position. So that's one important thing. And then once you learn about that, then learn how to use some of those tools in your areas. And I can tell you that I have started using some of these tools in my area, whether as a researcher, as a clinician, and you wouldn't believe the amount of time that I saved, the success that I generated, and also the feedback that I get from my clients. It's incredible. So I say, educate yourself, learn of what applications are out there, learn how to use them, perfect them, and then learn on how to interpret the results from the AI. And that's what I would suggest to all the healthcare professionals.
Exactly. Yes. So let's got the Q&A, or if also audience, if
Yes.
they would like to.
Yeah, I see that there are some.
Questions.
Yeah, some people are talking about the downsides. Well, we talked about that. The safety measures. Again, we discussed that in AI. How you determine the accuracy of AI? Well, again, that's where we talked about the black boxes. The black box for AI is that we don't know how. We are not technicians. So to know. So if you ask the question, AI, what do you think about this treatment for this disease or for this patient? And AI can come up with the answer. Well, we really don't know how the answer came up. I mean, really, unless we go through the algorithms that how AI went about and collected all this, we really cannot know the answer. And we don't know whether these sources are the right sources, whether they are accurate sources or not. So that's where people are worried about, is the transparency of identifying where I come up with the answers. And that's where the problem could occur, because if the AI produce results that are wrong results, who will be liable? And from in the US, we are very involved in liability, and we are very worried about liability. So if you raise your hand and say, it's not me, it's the AI, well, will the judge accept that? Will the laws accept that? So that's an issue, and we need to discuss that as well.
Exactly. So actually, we have a lot of questions, but we are running out of time. Yeah. So one question is regarding implementing AI for medical schools and how to include it in the curriculum and so on.
Yes, one area that I feel it is very useful is the virtual patient and the virtual scenarios. With AI, you can use virtual reality, where you can look at a patient, you can examine a patient, all virtually. You can make mistakes virtually. You can go through cases and scenarios virtually. What if I do this? What if I do that? What if I give this medication? What if I do this surgery? What if I do that intervention? All of that can be done virtually, and no one is harmed and no patient is touched. So that is so the virtual patient, virtual reality can be immense for that. Another thing, research. As I said, we used to have the case control studies, we used to have the meta-analyses. All of that can be done in a flash with AI. So yes, apply AI in those areas. For instructors, AI can generate exams for you. AI can generate cases for you. AI now can even generate videos for you. For whatever case you give the information, and AI can put it all together and produce a case that is virtual and can be used to teach your students on that. So there are all kinds of applications. Maybe another application is to look at using AI and see the administrative side, and see how certain curriculum is better predicting a better physician outcome or better physician skills than certain other curriculum. Looking at the different curriculum from a different medical schools around the globe, and see which subjects have more impact on that doctor, that successful doctor, versus a non-successful doctor, and what affected the practice of medicine through use of the right curriculum. So that's another area, and that could be another application for AI.
Definitely. Thank you very much, Prof.Assaf. Thank you for the valuable, informative, insightful discussion and presentations, and all these areas and all these opportunities, of course, for different things. Unfortunately, it is 8 p.m. UAE time, and so we have to. Unfortunately, we have to end the discussion.
Thank you. But I have, as you said, there is my email, and please feel free. Anybody send me a message, and I will respond. Hopefully within 24 hours.
Thank you very much. Thank you, Prof. So I want to extend my sincere gratitude to Prof.Assaf for accepting our invitation and delivering an outstanding and highly valuable presentation. I also wish to express my thanks to everyone involved in making this webinar possible, including the management of our college and UAE University. Special thanks are due to Prof. Michael Grivna, Dr. Ifat, Dr. Azhar, Mr. Ismail, Mr. Sajir, Mr. Aminu, Ms. Bayan, Ms. Khadija Balushi, and Ms. Miriam Anyadi for their contribution and support. A heartfelt thanks to our audience for their active participation in the webinar. Please remember to fill out the evaluation link in the chat to receive your CME certificate. Stay updated by following us on our IBH social media at Twitter, UAEU-IBH, in LinkedIn, Instagram, and Facebook. Also, you can access the recording of all our hosted webinars on our YouTube channel, Institute of Public Health-CMHS. We eagerly anticipate your future and participation in our upcoming webinar, which will take place on April 16. The title will be Interdisciplinary Approach to Public Health. Also, we would like to mention that the admission for our MBH and PhD program is open and will be closed by the end of April. So here are the links for who are interested to join our postgraduate programs. Thank you very much again, Prof.Assaf. Much appreciated. Thank you for our audience, and take care, stay safe, and goodbye.
Thank you very much. Take care. Bye-bye.